Your doctor has recommended that you undergo a colonoscopy. This video will give you a basic understanding of the procedure, why it's important, and what to expect before, during, and after the exam. Over the next few minutes, you will learn important steps on how to best prepare for the test. Be sure to carefully follow your physician's instructions. This video from the American College of Gastroenterology will answer some of the most frequently asked questions about colonoscopy, including: what is colonoscopy? How do you prepare for a colonoscopy? What happens during the exam? And what should you expect post-procedure? Colonoscopy is the careful examination of the large intestine, or colon, with a lighted fiber optic camera called a colonoscope. Colonoscopies are performed for a number of reasons, the most common of which is colon cancer screening. In fact, over the last several decades, colonoscopy has emerged as the preferred test for colon cancer screening, and it allows us to check for abnormal growths called polyps or colon cancer itself. Colonoscopy is among the most powerful tools in clinical medicine because of its extraordinary ability to both identify and remove precancerous polyps before they turn into colon cancer. Many people avoid getting a colonoscopy because they're anxious about the possible discomfort they may experience during the test, or perhaps because of the preparation that they'll have to do before the test.
I just wanted to check with you this morning to make sure that you understand that what we're going to be doing. We're going to very carefully insert the flexible tube into the colon and examine the 4 feet of your large intestine. If we see a lesion or we see a polyp, we're going to take it out right then and there. Now, I know you're very concerned about the procedure, but we're very careful, and we're going to do everything we can do to make sure that you're comfortable.
There are many options for bowel prep, and your doctor will recommend the best prep for your individual case. Bowel preps have come a long way in the last several decades, and there are now flavored preps, low-volume preps, and even pill preps that are available. Whatever combination is recommended for you, be sure to follow the directions exactly as instructed. In general, as you prepare for a colonoscopy, you'll be placed on a liquid diet the day before the exam. The diet should consist of clear liquids and should not contain food colorings. These foods may include fat-free bouillon or broth, water, plain coffee, plain tea, diet soda, or strained fruit juice.
In order to have a safe colonoscopy, your colon must be adequately cleansed. Some people say that the preparation is the worst part of the procedure. I don't know about that, but a clean colon is essential for a safe and an adequate colonoscopy. So it's very important that you follow my instructions exactly.
Prior to your colonoscopy, you should inform your doctor about any medications that you are taking, particularly aspirin products, arthritis medications, blood thinners, insulin, or iron products. Most medications can be continued as usual without interruption, but some medications could interfere with the preparation or the examination and need to be stopped prior to the examination.
Good morning, Mrs. Yuba. I know you're concerned about the test that we're going to be doing today, but I want to reassure you that we're going to do everything possible to make sure that you're comfortable and do it the safest way possible. Do you have any questions about the test before we get started?
You should expect to be lightly sedated for the procedure. We use this sedation to prevent you from experiencing any discomfort. The sedation also helps you not remember the procedure and assists in maximizing the accuracy and safety of the test.
The purpose of the medicine is to make you feel comfortable and not to feel any fullness or cramping. So you let me know if you're uncomfortable, and we'll give you more medicine.
The entire process of undergoing a colonoscopy is very simple. After having completed the bowel cleansing as directed by your physician, you'll report to the doctor's office and get an IV placed into a vein so that you can get medicines and fluids. Before the actual colonoscopy begins, you'll be given a mild sedative for relaxation and to prevent discomfort. During the procedure, the doctor will insert the colonoscope into the rectum and maneuver it gently through the inside of the entire colon. The scope transmits an image of the colon onto a video screen so that the doctor can check for any abnormalities. If precancerous polyps are found, they are removed during the procedure through tools that the doctor can pass through the colonoscope, thus preventing the development of colon cancer. colonoscopy is a safe procedure. Potential complications are rare but can occur. Your physician will discuss these possible problems with you, and you'll have the opportunity to ask questions. After the exam, your doctor will explain the results of the colonoscopy to you. If a biopsy has been performed or a polyp removed, you should expect the results within a couple of days. Some patients might experience mild cramping or bloating following the exam. This is normal and usually subsides within 24 hours or less. Finally, you will need to arrange for someone to pick you up after your colonoscopy, because you will not be allowed to drive home after being sedated.
I was scared at first having it done, but I feel so much better that it's over with. I know I don't have any polyps, and I feel free and clear of knowing I'm going to be okay.
Remember, colonoscopy is safe and effective, and is recommended for nearly all people at the ages of 45 to 50 because of its ability to find and remove suspicious growths before they become cancer. Early detection is the key to survival. For more information on colonoscopy or other digestive disease issues, you can visit the American College of Gastroenterology's website at www.acg.gi.org.